Hello and welcome to another live broadcast with MedStar Health. My name is Mashan Carter. September is Gynecologic Cancer Awareness Month, and today we're joined by several of our gynecologic cancer experts at MedStar Health. We have gynecologic oncologist, Dr. Ali Mahdavi, radiation oncologist, Dr. Katherine Chen, and medical oncologist, Dr. Mounika Gangireddy, to discuss this important topic. A gynecologic cancer diagnosis can be devastating, especially if the cancer is advanced. So we'll discuss the various types of gynecologic cancers, their risk factors, symptoms, and treatment options. So if you'd like to learn more, stick around, share this broadcast with your family and friends. Give us a like to let us know that you're watching, let us know where you're watching from. And if you have any questions, please share those in the comments because we'll take some time to answer those as well. All right, so doctors, welcome and thank you for taking the time out to speak with us today and educate our viewers. Before we begin, could you tell our viewers a little bit about yourself and the work you do at MedStar Health? I'll start with Dr. Mahdavi.
Good afternoon. I'm Ali Mahdavi. I'm a gynecologic oncologist. I treat women with gynecologic cancers, and my background in training is in obstetrics and gynecology, and then I did additional training in gynecologic cancer fellowship as well as minimally invasive surgery such as robotic surgery. My practice is based at MedStar Franklin Square Cancer Center, and I do surgery at Franklin Square Hospital and other MedStar hospitals in Baltimore area.
Thank you. Thank you very much. Dr. Chen.
Hi, everyone. My name is Dr. Katherine Chen. I'm a radiation oncologist working out of our MedStar Bel Air and Franklin Square sites. I did my training at UCSF in San Francisco, but I'm a Maryland native, so I'm very happy to be back home doing what I love. I feel like we have a really good team here at MedStar, so I'm lucky to be part of that.
Awesome. Thank you very much. And Dr. Gangireddy.
Hey everyone, I am Dr. Mounika Gangireddy. I'm a medical oncologist here at MedStar Franklin Square. I'm coming from Pennsylvania, but I'm originally from India, and my family is all here at this time in Baltimore, and I love working at Franklin Square. We have a great team here.
Awesome. Well, thank you all again for joining us. All right, let's give an overview. Let's talk about what gynecologic cancer is. So Dr. Mahdavi, what exactly is gynecologic cancer? I think you're on mute, Dr. Mahdavi.
Sorry about that. So gynecologic cancers are cancers that originate from female reproductive organs, and they include cancers of uterus, fallopian tubes, ovaries, and cancer of the vulva and cervix. The most common gynecologic cancer in the United States is cancer of the uterus. Each year, about 65,000 women in the United States are diagnosed with cancer of the uterus or endometrial cancer. Fortunately, endometrial cancer has a relatively good prognosis, and treatment is very effective in early stages of the disease. The second most common gynecologic cancer in the United States is ovarian cancer. Each year, about 20,000 American women are diagnosed with ovarian or fallopian tube cancer. Unfortunately, ovarian cancer in most cases is diagnosed in later stages, and the treatment is a bit more challenging compared to most endometrial cancers and require extensive treatment, including surgery, chemotherapy, and other systemic therapies. As I said, endometrial cancer is usually diagnosed in earlier stages and the prognosis is better.
All right, thanks for giving that background. So you mentioned endometrial, uterine, ovarian cancer. Of these types of gynecologic cancers, which ones are worse than the others? Is there a certain, type of cancer that we should especially look out for?
So in general, cancers that are diagnosed in later stages, they have worse prognosis. So there are two factors. One is when the cancer is diagnosed, and second factor is the nature or biology of the cancer. Ovarian cancer, unfortunately, in most cases, is diagnosed in later stages. And for that reason, the treatment is a bit more challenging. The prognosis in general is worse than cancer of the uterus or endometrial cancer. Having said that, as I will mention later, there are novel treatments and targeted treatments that we have available now that have made it possible to treat some of the most challenging and most advanced ovarian cancers.
All right, that's good to know. Could you share what are the common symptoms for gynecologic cancers?
In general, the most common symptom for gynecologic cancer is abnormal uterine bleeding, either vaginal bleeding in women after age menopause or younger women who experience irregular menstrual bleeding. If there is any bleeding between the monthly periods and cycles, that could be an early symptom for endometrial cancer or a precancer condition of the uterus. Pelvic pain, bloating, abdominal swelling, change in appetite, and feeling full shortly after eating, and any sort of fatigue or a change in basically sense of well-being could be related to some of these cancers. But in general, abnormal vaginal bleeding, pelvic pain, and abdominal distension could be early or first symptoms related to gynecologic cancers.
All right, thank you very much, Dr. Mahdavi. I want to turn to Dr. Gangireddy. Could you share what are some of the common risk factors for gynecologic cancer?
Yeah, sure. So the risk factors vary depending on the type of gynecological cancer that we are looking at. But in general, I would classify the risk factors into two: the ones that we can change or modify or treat versus the one that cannot be modified. So starting with the factors that we can change, our obesity has been known to be the biggest risk factor, smoking, there is HIV or HPV infection, as well as other medical conditions like diabetes and hypertension. These are some of the things that we can treat or change that are known to be a risk factor for gynecological cancers. Whereas the other ones that cannot be changed is age above 50. If you have any growth from your uterus, such as polyps, which are also known, or some thickening that can also cause is also known to be a risk factor, as well as genetic predispositions, such as having mutations that run in the family, like BRCA1, BRCA2, or a strong family history can also predispose one to gynecological cancer. Infertility is other one, or nulliparity, no pregnancy, is also a known risk factor for gynecological cancers.
And can gynecologic cancer be prevented? Are there any steps that we can take ahead of time?
Yeah. So it's not completely prevented, but there are certain steps that we could take to at least try to prevent. One of such thing is, as I was just mentioning, some of the risk factors are modifiable or we can change them, such as obesity, try to lose weight, eating healthy, exercising at least 30 minutes a day has proven benefit to prevent some of these conditions, as well as if you're on HPV vaccination is something that has changed recently because HPV is most commonly associated with cervical cancers. And we can talk more about pap smears, going and seeing your gynecologist for annual wellness visits to get some examination. So these are some of the things that you can do to prevent, as well as if you have a strong family history, going to a genetic counselor, getting genetic testing done early on, which can also impact on what we do later on.
All right. And a quick question relating to like family history. Would you consider, if your parent or grandparent had a history of gynecologic cancer?
Yeah, if you have a parent, if you have a grandparent, if you have a first sibling or first
Okay.
cousin that has a history of gynecological cancer, that's when we definitely refer to testing. And nowadays, all patients diagnosed with gynecological cancer, we do send them for gynecological testing.
Okay, that's good to know. Good to know. Thank you very much, Dr. Gangireddy. Dr. Mahdavi, so let's talk about screenings. Are there any screening tests for gynecologic cancers?
The most commonly used screening for gynecologic cancer is a pap smear. In the last 50 years, screening with pap smear has significantly decreased the incidence of cervical cancer in the United States. In most developed countries that cervical cancer screening is used routinely, the incidence of cervical cancer has significantly declined. In developing countries, cervical cancer is still one of the most common cancers among women due to lack of screening. Typically, screening starts in age 20s, and it could be either a pap smear or combination of pap smear and a human papillomavirus testing. Almost all cervical cancers are caused by infection with human papillomavirus or HPV. So testing for HPV could identify women who are at higher risk for cervical cancer in the future, and they could undergo surveillance methods to prevent progression to cervical cancer. Typically, pap smear and screening for cervical cancer continues until age 65. If women do not have any abnormal pap smear or abnormal HPV testing by age 65, there will be very, very little chance that they will develop cervical cancer after that age. The other screening test that has become more available to women is testing for ovarian cancer or genetic testing for hereditary cancer conditions that put women at higher risk for ovarian cancer. For example, a woman who is diagnosed with certain types of ovarian cancer, there is a 20% chance that the cancer could be caused by a gene that she inherited from her parents. So currently we recommend genetic testing for all women who are diagnosed with certain type of ovarian cancer. And if their tests are positive, then this could be extended to their first degree relatives. For example, if they have children, especially daughters, and this could be considered sort of screening in higher risk population. Now, if we consider early detection of certain types of gynecologic cancer with certain type of symptoms, early detection or early biopsy in women who present with abnormal vaginal bleeding can also be used as a sort of secondary screening in women who are at higher risk for cancer of the uterus. But to summarize, the answer to your question is cervical cancer with pap smear and certain population with genetic testing for ovarian cancer.
Okay, thank you, Dr. Mahdavi. At this time, I'd like to welcome our viewers again. If you're just joining us, thank you for tuning in to our Facebook Live. Today, we're talking all about gynecologic cancer in honor of Gynecologic Cancer Awareness Month. I'm here with Dr. Ali Mahdavi, Dr. Katherine Chen, and Dr. Mounika Gangireddy. So far, we've talked about different types of gynecologic cancers, the risk factors, and screening options, but we have much more to talk about. So stick around, share this broadcast with your friends, give us a like to let us know that you're watching. And if you have any questions for our doctors, please share those in the comments below. All right, sticking with Dr. Mahdavi, let's talk about treatment. After gynecologic cancer is diagnosed, detected, how do you go about treatment?
So in general, there are three types of treatments for gynecologic cancer. These include surgery, radiation therapy, and systemic therapies such as chemotherapy or targeted therapies. For early stage gynecologic cancers, such as early stage endometrial cancer or cancer of the uterus, or early stage cervical cancer, ovarian cancer, surgery is very effective and in some cases can cure the cancer. For example, the vast majority of patients with endometrial cancer, they present in early stages, and surgery could be curative in these patients. In patients who are at high risk for surgery and surgery is not an option for them, or they have more advanced disease, then radiation therapy and systemic therapy such as chemotherapy and targeted therapies could be used. Chemotherapy has been used for many decades in treatment of different types of cancers, including gynecologic cancers. But in the last 10 years, there has been a paradigm shift in systemic treatment for gynecologic cancers. And now the focus is more on targeted therapies. To compare chemotherapy and targeted therapies, chemotherapy is a type of treatment that kills cancer cells, and it also affects non-cancer cells. So it's usually associated with side effects because of the unwanted effect on normal cells. Targeted therapies basically target cancer cells and spare healthy tissue and normal cells from their effects. So usually the side effects are less, and at the same time they are more effective because they target the cancer cells and selectively kill cancer cells. We have recently there was a study published that showed that some of the women who were considered basically curable with systemic therapies had indeed they were cured with targeted therapies, including a type of class of drugs called PARP inhibitors. So in other words, women who had stage 3 or stage 4 ovarian cancer in the past, we counseled them that there's no cure for your treatment. A group of these patients are now cured of their cancer with this targeted therapy. So it's an exciting time to be in research for gynecologic cancer and being able to provide this novel treatments to women.
That's really helpful. That's impressive. The ways that we can, actually target the area that's affected. This is pretty interesting. I have a history of gynecologic cancer on my mom's side and my dad's side of the family. So this is especially interesting and good to know that there's, some tools that I could refer to if need be, if the time comes. So thank you very much for explaining that. So you mentioned surgery. Could you share a little bit more about that? And is it a standard part of cancer treatment? Are there any options, non-surgical options? I think you may have mentioned some a little bit earlier, but what about people who are a little bit apprehensive when, you mentioned surgery as a treatment option?
So in some cases, there are other options for treatment of cancer, especially in women who are at significant risk for surgery. But in general, in the last, I would say 20 years, there have been significant advances in surgical technology. So women who were considered to be high risk for surgery these days, with the new technology, we can proceed with minimally invasive surgery that's as effective as traditional open surgery and are associated with less complications, faster recovery, and better outcome. So yes, there are some alternatives to surgery, but in most cases we can safely proceed with surgery in women with early stage gynecologic cancers. As I mentioned, the emergence of minimally invasive surgery has changed the outlook of surgery for gynecologic cancers. Not too long ago, even when I was in training, for endometrial cancer, we had to make a large incision on the abdomen, and the patients were in the hospital for several days. And yesterday I did a surgery in a woman who had a gynecologic, very complex gynecologic condition, and we did a robotic surgery, and the patient was able to go home the same day. Many times we do full staging for cancer, including sampling of the lymph nodes with minimally invasive robotic surgery, and the patients are able to go home the same day. So similar to targeted therapies, there have been significant advances in the surgical options for women with gynecologic cancers.
Thank you very much. And one more question, Dr. Mahdavi, could you talk about robotic technology? How has that changed the landscape of care?
So in my opinion, robotic surgery has been very effective in doing minimally invasive surgery in women with gynecologic cancers that not too long ago, they were not candidates for laparoscopic surgery. Just to clarify different types of minimally invasive surgery, we either perform conventional laparoscopy, which is basically handheld instruments that are used through small incisions, and it's called conventional laparoscopy. And conventional laparoscopy has been around in gynecologic cancer for about 20 years or so. Using the robotic technology, we take advantage of a better visualization, three-dimensional view, and very delicate and precise movements of the instruments. In one sense, robotic surgery is a kind of misnomer. It doesn't mean that the robot does the surgery and the surgeon just observe. Throughout the surgery, the surgeon is in full control of surgery using robotic equipment. In other words, The robot is a equipment that allows the surgeon to do more precise and delicate surgery. The other advantage of robotic surgery is what we call it lymphatic mapping, or using sentinel node biopsy to detect cancer in the lymph nodes. With using certain type of marker or dye, we can target the lymph nodes or the organs that are at highest risk for involvement with cancer, and we just remove that lymph node that is at highest risk and basically save the other normal lymph nodes. This way we remove fewer lymph nodes, and arguably the treatment is even more effective. The side effects such as infection, bleeding, and leg swelling is significantly lower with this technology, which is possible using the robotic technology. We in the past, one factor that limited our ability to do minimally invasive surgery was large body habitus of some patients, obese patients. The surgery was very challenging, and we had to convert to open surgery in some women with multiple previous surgeries or larger body habitus. With robotic technology, the chance or the risk that we have to convert to open surgery is significantly lower, and the patients benefit from this aspect too.
Great, thank you very much, Dr. Mahdavi. Dr. Gangireddy, could you share how does the medical oncologist treat gynecologic cancer? What role do they play?
So as a medical oncologist, our main role comes in choosing the systemic treatment. As Dr. Mahdavi was mentioning, we do have lots of options at this time, one being chemotherapy, which are the drugs that are given through your vein, and they kill the cancer cells. But not only the cancer cells, it also kills normal cells, causing all these side effects. And more recently, we have targeted therapy where we particularly, it could be an infusion form, it's a pill form. For example, PARP inhibitors are pills. And these have shown wonderful results over the past decade, and fewer side effects because they're only targeting a particular receptor. And there are more studies in process to see if we can develop newer drugs in that case. And the third part would be immunotherapy. That has also been established in many management of many cancers, and now it's also being used in gynecologic cancers. And our role come into play as an adjuvant treatment. That meaning you give treatment after you are done with surgery, just to prevent later relapses or recurrences and to prolong the survival. Or sometimes if the surgeon thinks that we can give systemic treatment before surgery in order to shrink the cancer so that they can become more operable, which is called neoadjuvant, even then we would give them upfront treatment.
All right. And are there any new treatments on the horizon? Anything that we should be aware of for gynecologic cancers?
Sure, there are a lot of clinical trials going on where as I said, they're looking at a lot of different targeted agents or targeted receptors on the cancer cells. And recently they've been also working on something called antibody drug conjugates. These are the drugs they have a component of an antibody which is more targeted, and they also have a chemotherapy portion linked to it. And these are the newer drugs that are being studied in different cancers, but they're also looking at gynecological cancers these days, apart from the ones I mentioned above.
Okay, thank you very much. Turning to Dr. Chen, what is the role of the radiation oncologist in treating gynecologic cancer?
Sure. So radiation treatment is a really important part of our curative standard of care treatments for a number of different gynecologic cancers. We often use this in combination with surgery or with chemotherapy, or sometimes all three. really our goal is to sort of match the intensity of our treatment to how aggressive we believe the cancer to be. So for example, sometimes after a patient has had a surgery for a cancer, we may use radiation to treat the area that the cancer was previously in if we are worried that is at risk of coming back. We can also use radiation to treat cancers actually without the need for a surgery. So for some patients, like Dr. Mahdavi mentioned earlier, they may not be good candidates for a surgery. Some of that may be due to other health issues they have going on. We always try and see the patient as sort of a whole person, not just a cancer. Sometimes it's because the tumor is in a location where a surgery could essentially do more harm than good. So radiation is a really important part of treatment in those situations. I would say that if there are cancers, for example, that are more advanced or they're causing symptoms such as pain, maybe they're bleeding, we can also use radiation to address those symptoms.
Great. And then could you elaborate a little bit more about the different types of radiation therapy that's available?
Sure. So we have two main types of radiation treatment available for most gynecologic cancers. One is external beam radiation therapy. One is a type of radiation called brachytherapy. So external beam radiation, this is sort of our kind of standard bread and butter radiation. Most of the time when we're talking about radiation, this is what we talk about. Important things to know, this is a non-invasive treatment. So essentially during this, we are directing high dose X-rays from outside the patient's body, targeted into the area of the tumor or the areas that we feel are at risk of cancer spreading to. And modern radiation is very specific in the way that we do this. We're able to shape our radiation really carefully to the areas that we want to treat and away from the areas that we don't want to treat. So that's one of our treatment options for gynecologic cancers. The other, brachytherapy, is different in the sense that it is more an internal type of radiation, right? So while external beam radiation comes from outside the body in, brachytherapy, we actually place the radiation source directly in the area of the tumor. In a lot of ways, we can access this sort of similar to a pelvic exam. We'll place the radiation applicator directly in the area, deliver a treatment for some period of time, remove the applicator so there's no radiation actually left inside the body. And the reason that this can be really helpful for a lot of gynecologic cancers is because it lets us essentially deliver a higher dose of radiation with not a lot of radiation dose going to the nearby tissues around that we're trying to avoid. So oftentimes we may use one of the treatments or the other. Sometimes we'll actually use them in combination with each other because they sort of work in different ways. Sometimes we want to cover a larger area and sometimes we want to cover a smaller area.
All right. And what potential side effects should people be aware of when it comes to radiation therapy?
Yeah, it's a great question. So I think one general side effect of radiation is that patients can feel a little tired, a little fatigued during pretty much radiation treatment to any part of the body. So that includes for gynecologic cancers. I think otherwise, I would say that the side effects from radiation are limited to the part of the body that we're treating. And part of that is, because our radiation is so shaped, because there is some low dose but safe radiation to normal tissues, that's what causes the side effects. So when we are treating gynecologic cancers in the abdomen and the pelvis area, some of the low dose to the bowel can cause things like nausea, maybe looser stools or diarrhea. If there's radiation dose going to the bladder, it can cause patients to be peeing more frequently. For cancers that are located closer to the skin, for example, the vulva, they may get some skin irritation in that region, sort of like a sunburn. In general, radiation can also cause some scar tissue buildup, which is important when we're thinking about things like the vagina and sort of patients that may need to get pelvic exams after. We have ways of dealing with that. And I think the last thing I'll mention, especially when we're thinking about gynecologic cancers, is that radiation can affect fertility. So for our patients who are of childbearing age, we will often send them to specialists to think about strategies to sort of help manage that before they even start radiation.
Very good to know. Thank you very much. So how long does a course of radiation therapy usually last?
It's one of our most popular questions in the office. In terms of external beam radiation, for gynecologic cancers, I think a pretty standard course is somewhere on the order of 5 weeks. So it is a longer treatment, and 5 weeks meaning 1 treatment a day, Mondays through Fridays. And the reason that we do it over this period of time is because we oftentimes are covering a larger area. We want to make sure that we're being really gentle with the treatment and not causing too many side effects. So that's a pretty standard course for the external beams. Sometimes it can be longer depending on the kind of tumor we're treating, whether it has been removed by a surgery or whether the tumor is still there that we're targeting. For the brachytherapy treatments, those treatments are generally shorter in the sense that we may only do 3 or 4 of those, but each of those treatments is typically longer because it is more like a procedure. So the external beam treatments each day are probably in and out, sometimes in less than an hour, 30 minutes, but the brachytherapy can be longer than that.
Thank you very much, Dr. Chen. So as we bring this conversation to a close, I'd like to turn to Dr. Mahdavi. Why should someone choose MedStar Health for gynecologic cancer treatment?
So at MedStar Cancer Center, we work with a group of physicians, nurses, physical therapists, and other healthcare specialists who have dedicated their work to help women with gynecologic cancers. We closely work with radiation oncologists, medical oncologists, pathologists, radiologists, and we on a weekly basis we get together to discuss cases and seek opinion of other colleagues for comprehensive treatment. So I think this multidisciplinary approach to gynecologic cancers would help the patients to get the best available treatment. And also at MedStar, we offer clinical trials that make available the novel and targeted therapies to women with gynecologic cancers.
And one more question. Why is it important to seek care from a gynecologic oncologist?
So gynecologic oncologists are physicians who have extensive experience and training in treatment of gynecologic cancers. In addition to undergrad training, medical school, residency, most of the gynecologic oncologists in the United States, they complete formal fellowship in gynecologic cancers that are usually 3 or 4 years. So we have extensive experience in surgical options for treatment of gynecologic cancers, in addition to other treatments that we discussed, including chemotherapy and targeted therapies. One aspect of gynecologic oncology specialty is that we provide comprehensive care to patients with gynecologic cancers. And I believe we are the only specialists who could offer systemic therapies such as chemotherapy and targeted therapies, in addition to provide surgical services, including radical cancer surgeries to our patients. So I think there is a continuity of care in gynecologic oncology specialty, and that would help the patients to better understand the process of treatment and have a closer relationship with their provider.
Thank you very much. And I have one last question for the entire panel. Considering everything that we have shared, all this important information, what final message do you have to share to our viewers? I'll start with Dr. Mahdavi.
I think it's important for most women to pay attention to some of the symptoms that could indicate early stages of a gynecologic cancer. As I mentioned, abnormal uterine bleeding, vaginal bleeding, symptoms such as bloating, pelvic pain. Take those symptoms seriously and report them to their physicians and gynecologists. So, and also be compliant with the screenings that are available, including Pap smear, and for younger women, vaccination against HPV infection is very important.
Thanks, Dr. Mahdavi. Dr. Chen, what message do you have for our viewers?
Yeah, I agree completely with what Dr. Mahdavi said. I think definitely pay attention to your body. If there's something that is worrying you about the body you've been living in for decades, talk to a doctor. Don't be afraid or embarrassed. We've really seen it all. We want to help you as best as we can. And screening is so important. The earlier that we can catch these types of cancers, the less intensive treatment is, also the more successful. So sometimes we can even catch them before they turn into cancers. Overall, I think the fact that you're here listening to this broadcast already means that you're getting information, that you are becoming aware of different things. So I think that's a really good thing.
Thank you very much, Dr. Chen. And Dr. Gangireddy, what message do you have for our viewers?
Yeah, thanks for watching. And I know you have heard a lot of information at this time. Think through it. And I completely agree with Dr. Mahdavi, Dr. Chen. Once again, I just want to reiterate that you know your body well than most other people do. So recognize if something is not right, you need medical care, just seek it and just go seek medical care whenever you can. And yeah, be compliant with your screenings, because screening can detect so many precancerous as well as cancerous lesions. And the minute we find it in an early stage, the higher the chance of getting it cured. You're going for curative intent, and cure is the best thing we can hope for. So I hope all you guys can call your gynecologist after this and get your screenings. Okay.
I think that's a good point to end on. Thank you very much. That's a wrap for our broadcast. I want to thank all of our doctors, Dr. Mahdavi, Dr. Chen, and Dr. Gangireddy for joining us and taking out the time for this and to educate our viewers. And thanks to all of our viewers for tuning in. We really appreciate your time. For more information or to schedule an appointment with us, please call 443-777-7990. We're going to put that number as well as just a few more things as well for you to know, some resources as well for you to check out. All right, thanks again, and we'll see you next time. Bye.
Thank you.